Since the passing of the Affordable Health Care Act, also known as Obamacare, there has been plenty of controversy. But before we start talking about the goods and bads about Obamacare, we must explain what it is. President Obama signed the Affordable Care Act on March 23, 2010. The Affordable Care Act's plan is to significantly reform the U.S. healthcare system. Since the form of Medicare and Medicaid in the 1960s, the changes to the system are to increase the quality and affordability of health insurance. Also to lower the insured rate by expanding insurance coverage, and finally, to reduce the cost of health care for both the individual and government.
And now I'll talk about the pros of the Affordable Health Care Act. America has the costliest health care system in the world. America spends 17% GDP, where the average for other rich nations is around 9%. Also, only 1 in 10 of Americans have coverage. The Affordable Health Care Act, signed by President Barack Obama, is supposed to deal with the problems of America's health care. According to surveys from research organizations from Commonwealth Fund and the RAND Corporation, show that the number of people uninsured has dropped anywhere from 10 to 12 million. These groups also say that hospitals are seeing less insured patients coming in for treatment. According to a Commonwealth Fund survey, 60% of people who got new coverage use it to pay for the services, and 62% of those people would not have been able to pay for the services without the new coverage. This shows that people are actually using the coverage given to them and helping out their overall health in the process. Other positives to the Affordable Care Act include almost everybody will have some type of high-quality health insurance coverage, which cannot be dropped with the help of the health insurance marketplace. Depending on how many employees a company has, the company must supply health insurance to them.
According to the Krazer Family Foundation, 47% of people in America have an unfavorable opinion towards the passing of the Affordable Care Act. The Affordable Health Care Act was supposed to be easy to apply and provide a way for low-income families to get affordable health care, but evidence suggests that this act has been more of a problem instead of a solution. One problem is the process of signing up. The website healthcare.gov has many bugs and glitches that need to be fixed. Firstly, before you can even browse through the plans, you have to create an account. In this process, you get error messages and usually timed out. Another problem is the extensive wait to even get the insurance you want. You have to send your information to the government and have it checked, and if there are any errors, the information will be sent back and you have to restart. If your information checks out, then you get to fill out an application for the coverage you want, but then the process of waiting continues. This application has to be sent and also checked for errors. Along with the sign-up, the Affordable Care Act brings along other problems. In order to insure millions of people, new taxes will help cover the cost of this. These taxes will mainly hit healthcare industries and higher-earning people in America. Also, higher-earning individuals, along with no-income individuals, will have to pay a higher initial startup fee, and their monthly fees will be twice as much as regular health care. Another negative is that if you can't get insurance, then you must pay a fine. If you can't afford insurance, then how can you pay for fines for not having it?